3.
Hi, I'm Dr. Bill Fulton, Medical Director at SKINovative in Gilbert, Arizona. And today I have Carol with me. Thanks for being here, Carol.
My pleasure.
Carol is here to answer some commonly asked questions about hormone replacement. As we get older, all of our hormone levels drop. And so all of us at one time are going to start asking questions about hormone replacement therapy. And so I'm going to ask Carol some questions about that. So Carol, the first question is, tell me why you wanted to have hormone replacement therapy.
Let's see. I have a very demanding full-time job. I was not sleeping for years, really. I had just perpetual hot flashes at night. So then I'm exhausted during the day. I had no energy, and with that, I had issues with my libido.
Okay.
And so, yep, I shared that with you.
Well, great. And so nobody likes those symptoms, and the great thing is you don't have to live with those. And so tell me, what was the hormone treatment like?
Well, we right away, we started with the pellet, and I immediately felt better. I slept better, the hot flashes disappeared. I have been taking it now, I think about 9 months, and I don't know if I've even had one hot flash. So
That's awesome.
It's been amazing. That's really.
Awesome. How's your sleep been, your energy?
I sleep great. I'm working out regularly, and I feel like a different person. Yeah.
That's awesome. So somebody who's watching this video who's a little bit nervous about hormone replacement therapy or asking questions, what would you tell them?
I'd say that it's not necessary to go through that discomfort. I'm 62 and I still have a robust life ahead of me, and I want to live it.
I love that. I love Carol's smile. And that's really what hormone replacement therapy is really for. It's to give someone that energy back, that mental clarity back, have them be able to sleep better, and just an overall better way of life. If you have any questions about hormone replacement therapy, please call SKINovative at 480-917-7546. Again, that's 480-917-7546. Thank you, Carol.
My pleasure.